Welcome to the CDCA Candidate Orientation presentation. This online orientation is a supplement to the candidate manual and highlights broad categories of the examination process. Orientation is not meant to be a substitute for careful review of the information in the candidate manual. This orientation will be most helpful if viewed after reading the candidate manual and will hopefully answer your questions and help you prepare for the examination. Watch this presentation and other presentations on case selection. Things are constantly changing in dental licensure, so it is important that you contact the state board in the state or states that you are applying for licensure and confirm their licensure requirements and exam acceptability. The CDCA administers the ADEX examination in dental hygiene, which consists of two parts: the patient treatment clinical examination and the computer simulated clinical examination. The computer simulated clinical examination, or CSCE, is taken at a prometric testing center and is scheduled individually by each candidate. The CSCE can be taken either before or after the patient treatment clinical exam. Information about the CSCE is contained in the registration and CSCE manual, which can be accessed on the CDCA website. A score of 75 or better must be achieved for each part of the ADEX examination. This orientation is in preparation for the patient treatment clinical examination. The purpose of the dental hygiene examination is to assess your clinical ability in a fair and unbiased manner. It is important that you present a patient that allows you the opportunity to demonstrate your clinical skills. If there is not enough calculus, you will not be able to demonstrate your ability to remove it. The content of the examinations are based on findings from a national occupational analysis, which identifies the necessary entry-level skills for a new dental hygiene graduate. The results of your performance are reported to each of the licensing jurisdictions recognizing the ADEX dental hygiene examination. CDCA is a testing agency and not a licensing jurisdiction, so you must apply for licensure directly to the state or states in which you are interested to obtain a dental hygiene license. As mentioned earlier, the purpose of this orientation is to provide some additional information to supplement the candidate manual. We will go through the process of the examination day so that you will know what to expect and can plan and organize accordingly. We want to emphasize several important requirements and restrictions and familiarize you with the exam forms and their use. And finally, to review the overall flow of the exam day. Videos are also available for your review to help you prepare for your examination. There will be a lot of people involved in delivering the examination and supporting you during the course of your exam day. Here is a brief description of who you can expect to be at your examination. Each site has a chief examiner who will conduct the registration session and will be able to answer any questions you have about the day. The chief will be on the clinic floor and will be available to you to ask any additional questions or voice any concerns throughout the examination. The clinic floor examiners, or CFEs, will be at registration, and they will also be on the clinic floor to answer your questions and assist you in navigating the exam process. The CFEs will check you in and determine your patient's eligibility to sit for the examination. All candidates escort their patients to the sign-in desk for both pre- and post-treatment evaluation and meet with the DSM to enter your exam data and findings. Each candidate must meet with the DSM twice during the exam session. Runners and clinic assistants are provided by the school. Often they are first-year students. Runners will return patients from the evaluation area to the candidate clinic after each evaluation is complete. Everyone you come in contact with there is to answer your questions and assist you through the process of your exam day. School coordinators are also available to assist with equipment problems. Candidates will not come into contact with the grading examiners or clinic assistants who are in the evaluation area. It is important that anonymity be maintained throughout this blind exam process. Your exam day will start with a brief registration session where you will receive your examination materials, and then you will go into the candidate clinic to set up. CFEs will be on the floor and ready to check your patient in as soon as you are ready. The evaluation examiners will start grading patients at 7:45 a.m. and 12:45 p.m. Please arrive 15 minutes prior to the beginning of the registration to allow enough time for distribution of all examination materials and for registration to begin on time. The morning session ends at noon and the afternoon session at 5 p.m. Times may vary. Please check the examination site schedule. When planning for the examination, you should be aware that the time allowed for the entire examination includes the time during which the patient will be in the evaluation area. The minimum time during which the patients will be in the evaluation area for each visit is approximately 30 minutes, and it could vary depending on the procedure being evaluated, testing site, or number of candidates. Make sure that your patient is aware of the schedule and the time commitment in sitting for this examination. Registration will be the first activity on the day of your examination. Registration is scheduled for 30 minutes just prior to the start of your examination session. You should arrive early so registration can be completed on time and the examination can be started promptly as scheduled. You will need to present 2 forms of ID for admission and a copy of your online application, which has your 3-digit sequential number. Examples of acceptable IDs are current driver's license, passport, military ID, or official school ID. A second form of identification can be a signed credit card or a signed voter ID card. Bring any forms you have already completed and your radiographs to registration. Download, complete, and print the form verifying that you have completed this orientation and bring it to registration. You will be informed about the location of registration by email. Remember, registration is just for candidates, so have your patients stay in the waiting room until you are ready to bring them into the clinic. As soon as registration is complete, you will go right into the clinic and begin to set up your operatory. At orientation, you will receive a sheet of peel-off labels and a white envelope filled with forms that will be used for the examination. In your white envelope, you will find instructions on how to use your ID labels. We will briefly review this process in the following slides. The first small label should be placed on the upper left-hand corner of the large white envelope that contains your examination forms. At the start of the examination, peel one of the large ID labels off the backing and place it directly on your clinic gown. If you need to meet with the DSM of your clinic floor, you should remove your gown and place the second ID label on your scrubs for identification. The envelope contains all of the needed forms and a page of peel-off candidate ID labels with your candidate sequential number and candidate ID number on them. These forms will be reviewed later during the orientation and in more detail during candidate registration. Each form has the symbol, and you will affix a candidate ID label over it to cover the symbol. You will also place an ID label on the radiographs and on a clean patient napkin when sending the patient into the evaluation area. Original or copies of a panoramic film or full-mouth set of film-based radiographs or digital prints taken within 3 years. These radiographs are usually returned, but may be retained at the discretion of the examiners. School logos or identifiers should be covered. A candidate ID label should be attached in case the radiographs become separated from other materials. Candidates will not be permitted to take or retake radiographs at the examination site. In the white envelope, you will find your candidate ID badge. During the examination, you must wear this photo ID badge on your outermost garment at all times during the examination. Since this is an anonymous examination, you may not display any identification such as your name, school, or military affiliation on any clothing, forms, or images. No candidates will be allowed on the clinic floor without an ID badge. This ID badge must be returned in the white envelope at the end of the examination. If you will be utilizing the services of an interpreter during the examination, he or she must also be registered and wear a green ID badge while in the examination areas. During registration, the chief examiner will give you the green interpreter registration form for you to complete and sign. The interpreter will need to bring two 2-inch by 2-inch photographs of themselves and 2 forms of ID, one with a picture, and both must have a signature. This interpreter badge must be also turned in at the end of the examination in your white envelope. Many topics and exam policies will be quickly reviewed during registration. The location for sign-in for the evaluation area will be shown, and the process of how to sign up for CFE check-in will be explained. The chief will answer any questions regarding the exam process before everyone is dismissed and goes to the candidate clinic for setup. Electronics are not allowed in any of the clinics during the examination day. Any electronic device that sends or receives a signal, can make calls, take photographs, or record must be in the off position. These devices may be utilized in the waiting rooms or other non-clinical areas if the facility allows. Be sure that your patients are aware of this restriction and that they realize that you may be dismissed from the examination if this rule is violated by either you or them. The policy on electronics will be reviewed again at registration so that there is no misunderstanding about the consequences surrounding the use of electronic devices by you or your patient. During registration, these sign-in deadlines will be reviewed. This examination cannot be started unless the candidate will have a minimum of 90 minutes of patient treatment time. Pre-treatment evaluation can take 30 minutes, so a sign-in at the desk 2 hours before the end of the examination is necessary to assure that 90 minutes of treatment time will be available. To obtain the full 2 hours of allotted time, patients should be signed in for pre-treatment evaluation by 9:30 a.m. for the morning session and by 2:30 p.m. for the afternoon session. When registration is finished, all candidates go to the candidate clinic to set up. During the 30 minutes allotted for setup and check-in, set up the operatory enough to receive the patient, review and update the medical history and oral exam, making sure to record any significant findings, and take and record blood pressure. When this is done, sign up on the green CFE check-in sheet. You can complete setting up your operatory, ultrasonics, instruments, etc. while you are waiting for the CFE to come back and during the time your patient is in the evaluation area. Although you have more than enough time during this examination, it is important to use your time wisely, but it is also important not to rush. There is a 4-hour time block to complete the examination process. Your patient's blood pressure must be taken and recorded on the medical history on the day of the examination and prior to each examination if two candidates treat the same patient on one day. This does not need to be witnessed by a CFE. Candidates may take the blood pressure as many times as they want before presenting the patient to the CFE for check-in. Once a patient is presented to the CFE, if the blood pressure is too high, that is 160/95 or above without a medical clearance, the candidate is given one additional opportunity to present the patient, and if the blood pressure is too high, the patient is declared ineligible for treatment and the examination is stopped. Patients with known allergies to latex, if the clinic is not latex free, or with a history of taking IV or orally administered bisphosphonate medications will not be permitted to sit for the examination. Candidates who are sharing a patient with a need for antibiotic prophylaxis must treat the patient the same clinical day. Treatment of the same patient on subsequent days is not permitted. The Centers for Disease Control-based guidelines for infection control must be followed during all clinical procedures and when setting up, during treatment, and when disinfecting your assigned cubicle. Violations of the CDC guidelines will result in failure of the examination. When your operatory is prepared, you can go to the waiting room and bring your patient into the candidate clinic. Protective eyewear must be worn by you and your patient during clinical procedures and by the patient when being evaluated at the evaluation station. Penalties may be assessed by CFEs if violation of barrier technique or patient management occurs. Gross violations of infection control guidelines will result in the examination being stopped and failure of the examination. The administration of injectable anesthesia by qualified candidates is permissible, but not graded within the ADEX CDCA examination. Each examination site will determine if they will allow the use of ILA at their site. Check the site information sheet on the CDCA website to determine if the test site you are considering allows ILA. If allowed, in order to be permitted to utilize an injectable local anesthetic, you or your program director must provide documentation to the chief examiner that you have completed the coursework required by the state board in the state where the examination is being given. If you are a graduate or from another state, you must provide documentation from your state board authorizing you to use injectable local anesthesia. The CFE will review the patient's medical history before approving the use of ILA. Injections by a third-party practitioner are not allowed. The only exception to this policy may be in states where injectable local anesthesia is not legal procedure for dental hygienists, and the test site agrees to provide and arrange for a dentist to administer ILA. Before checking in with the CFE, complete your anesthesia request on the back of the progress form. Indicate the type of anesthesia you intend to use, both injectable and non-injectable anesthesia, on the form. After you have completed your treatment, finalize your anesthesia record so that it accurately describes the type and amount of anesthesia actually administered. If you would be administering anesthesia for patient comfort, it is suggested that you administer your anesthesia before pre-treatment evaluation, because the patient will be seen by 3 examiners during that visit to the evaluation area. If you will be sharing a patient, the total amount of anesthesia administered that day must be taken into consideration. For check-in, the CFEs will come to operatories in order in which candidates have signed up on the green CFE check-in sheet. The CFE will look that all forms and radiographs are present, labeled, and completed properly. The CFE will evaluate the medical history and radiographs to verify that the patient is eligible to participate in the examination and approve your anesthesia request if appropriate. This check-in constitutes the beginning of the examination, and after this time a backup patient may not be utilized if this first patient is determined ineligible by the CFE. If you realize that your patient is not eligible due to medical history, radiographs, or clinical findings, do not present the patient to the CFE. Instead, use a backup patient if you have one. Presenting a patient that is not eligible is considered lack of clinical judgment and will be a reason for failure. Once check-in is completed, you can administer any approved anesthesia, gather your forms and instrument tray, and escort your patient to the DSM to enter or confirm your case selection data in the grading system and sign into the evaluation area. Utilize the case selection worksheet to record the 12 surfaces of qualifying calculus in your case selection, as well as the primary quadrant and 2 additional posterior teeth that are part of your case selection. You can enter your case selection in the grading system online from the information contained in this worksheet. Bring this case selection worksheet or the online printout when you meet with a DSM before the evaluation. The DSM will review case selection information with you to confirm the accuracy of the entry in the scoring system. Changes to your case selection information previously submitted online can be changed at this time. Remember, there must be 12 surfaces of qualifying calculus selected for calculus removal, a primary quadrant and 2 posterior teeth from a secondary quadrant as part of the case selection. Of the 12 surfaces, 8 must be on posterior teeth, 5 surfaces must be on proximal surfaces of posterior teeth, with a minimum of 3 proximal surfaces on molars. The proximal surfaces on molars must have proximal contact within 2 millimeters on at least 2 of the 3 proximal surfaces. If your selection does not meet these criteria, the scoring system will reject the submission and you will need to submit a new selection that does meet the criteria. Patients will be seen by 3 independent examiners while in the evaluation area. The initial case selection will be evaluated by all examiners. The first examiner will select 2 additional surfaces of qualifying calculus from within the case selection and add those to the 12 surfaces submitted by the candidate. All 3 examiners will evaluate the 14 surfaces. The grading system will select the surfaces to be graded from those that were validated by 2 or more examiners as having qualifying calculus. The candidate has 14 opportunities to have 12 surfaces of calculus validated and assigned. 3 teeth for calculus detection will be assigned, and 2 teeth for perio measurement will also be assigned. If, after pretreatment evaluation, you have not accrued the minimum number of points needed to possibly pass this examination, the exam will be stopped. During pretreatment evaluation, points will be lost for not satisfying the criteria for a sufficient number of surfaces with qualifying calculus, not meeting the calculus 853 distribution requirement, and/or initial case selection requirement. If the exam is stopped, the chief will be notified and will let you and your patient know that the exam is being stopped and a failure will result. The chief will review this process during registration. You can avoid this by making sure the calculus requirements have been met. The ADEX exam has a separate calculus detection exercise, which is completed during patient treatment. As was just mentioned, at pre-treatment evaluation, the examiners will assign 3 teeth from outside the case selection for you to determine the presence or absence of qualifying calculus. The teeth will be written in the boxes on the lower part of the progress form. When the patient returns from pre-treatment evaluation, the CFE will transfer the tooth numbers for the 3 teeth assigned into the candidate findings worksheet, which is on the back of the case selection worksheet. You are strongly advised to complete this calculus detection exercise before you start to remove any calculus in the mouth. If qualifying calculus is present on the assigned teeth, answer yes. If it is not present, answer no on the progress form for each of the 4 surfaces. 2 teeth will be assigned from within the case selection for you to demonstrate your skill at determining periodontal measurements. When the patient returns from pre-treatment evaluation, the CFE will transfer the tooth numbers for the 2 teeth assigned onto the back of the case selection worksheet. When you have completed your treatment and removed the calculus, probe the 3 lingual surfaces on both teeth and record your findings in the grid on the back of the case selection worksheet. It is important that you probe after treatment because the examiners will be probing during post-treatment evaluation, which is after treatment, so that your findings will be gathered under the same conditions. When your patient returns from the pre-treatment evaluation, you may begin your treatment. First, note the finish time placed on the progress form. This is the time by which the patient must be signed in at the sign-in desk for post-treatment evaluation. Second, complete the calculus detection exercise on the 3 assigned teeth. Third, remove all supra- and subgingival deposits, biofilm, and stain from all surfaces of all teeth within the case selection. Next, probe the lingual surfaces of the 2 assigned teeth and record your findings. Finally, complete the anesthetic record on the progress form and escort your patient to the DSM and sign in for final post-treatment evaluation. Candidates clean up their units while the patient is gone for post-treatment evaluation. When the patient returns, 2 copies of the post-operative care agreement are signed and dated. 1 copy is given to the patient and the other is returned in the white envelope. When this is complete, you can dismiss your patient. You will sign the back of the medical history and consent forms and then gather all forms and the white envelope and check out with the CFE. If you plan to share a patient, be sure that you are scheduled in different sessions. Notify the CDCA regarding scheduling if you will be sharing a patient. If the patient is taking prophylactic antibiotics, treatment by both candidates must occur on the same day. Each candidate should have their own copy of radiographic images in case CDCA retains the images for any reason. Each candidate needs to complete all of their own forms, including a medical history, blood pressure, and consent form. It is important that both candidates agree on each other's case selection. 2 candidates cannot select the same teeth as part of their case selections. Be sure that your patient has time to eat between sessions. There are ways that you can save time and feel more organized and calm on your exam day. First and foremost, select a patient that is dependable and you feel confident will come on the day of the examination. It doesn't help if the patient has a full mouth of qualifying calculus but doesn't show up on the day of the exam. Meet with your patient within 30 days of the examination and complete the medical history and consent forms. On exam day, retake the blood pressure and have the patient sign and date the medical history and consent forms. If any medical condition may cause a question as to the patient's eligibility, get a medical clearance from the patient's physician. It's better to have clearance and not need it than to not have one. To have all this done saves a lot of time and stress. Double check your case selection to be sure it meets the qualifying calculus requirements. Choose a case selection that has more calculus than just the 12 qualifying surfaces of calculus, so the examiners will be able to identify 2 additional surfaces to add to the 12 surfaces you submitted. This gives you 2 additional opportunities to have 12 surfaces of calculus validated. When you enter your case selection online, it will confirm if your 12 selections meet the 853 calculus distribution requirements. If you do this ahead of time, it saves time and it relieves the stress of having to select different teeth on the day of the examination. You can enter your case selection up to 48 hours before the first day of the examination at your site. You can enter as many selections as needed till this is accepted. There is no penalty for multiple submissions. For radiographs to be considered diagnostic, the apices of all roots of teeth within the case selection must be visible on at least one of the images. Your patient will be ineligible if this criteria is not met. If visible on a panoramic image, that is considered acceptable. Clinics can be cold, so suggest to your patients that they bring several layers of clothing. Some patients even bring blankets. On exam day, bring some food and liquids to snack on outside the clinic when your patient is in the evaluation area. Chances are you may not feel like eating before the exam, but you need to keep your blood sugar up, so bring some food or liquids. If the site will have the clinic open before registration, go early and set up so that you can bring your patient directly in after registration. You can save a lot of time by doing this, but don't be late for registration. Accidents happen and instruments get dropped, or you may need to utilize a backup patient just in case. Have a spare set of sterile instruments so that you can have a quick replacement if necessary. It is recommended that you bring your manual in case you want to look something up or use one of the checklists. There is plenty of time to complete this examination, so don't let yourself feel rushed. Keep track of your time during treatment so that you will leave time to probe. Don't bring a lot of extra papers and materials into the exam. It clutters up your workspace in the operatory, and that can make it feel more difficult to find something when you need it for the examination. You are allowed to bring in your candidate manual and your exam forms. No previously completed dental, calculus, or periodontal charting information can be brought into the examination area. Look around your operatory. Make sure there is nothing there that will identify you. Cover your name if it appears on your instrument cassettes, loops case, lab coat, or anything else. Remember, if your patient is late, don't panic. You have until 10 a.m. for the morning session and 3 p.m. for the afternoon session to check in. During this examination, the use of chairside assistants, disclosing solutions, and air polishing are all prohibited. It is important to remember to complete calculus detection before beginning treatment and to leave time to probe the perioteeth after treatment. Your finish time is the time you have to be signed in at the evaluation area sign-in desk. There are strict penalties for not meeting these time deadlines. Results are not available on-site right after the examination. When the exam scores are available, you will be notified to log in to your profile to receive your results. You will also be emailed a survey to evaluate your exam experience. Please respond and give us your honest feedback. If there is something we can do better, please let us know. Now you know how the exam day will flow and what to expect. We will briefly review the exam forms so you can understand how they are utilized and how to fill them out. If you want to have access to the exam forms while screening patients, all the forms are available on the CDCA website. To save time on the day of your examination, your forms can be completed and brought to the examination. However, the progress form printed on heavier cardstock in the white envelope must be used during the examination. The progress form is considered the dental record for this examination, and all entries must be done in ink. All of the information requested on the form must be completed. The progress form is the only method by which candidates can communicate with the evaluators. Candidates' notes on the front of the progress form permits you to communicate information to the examiners. Comments should be specific but brief. They must be reviewed and initialed by the CFE. The entry of CFE examiner numbers and time does not necessarily indicate agreement. All missing and not fully erupted teeth, as well as implants, should be indicated on the dental chart. If a patient is shared by other candidates during the different examination time, this information must be entered in the appropriate boxes on the progress form. If a candidate presents verification of injectable local anesthesia training, a red ILA stamp is applied to the circle at the top and the back of the progress form during registration. All anesthesia requests are recorded on the back side of the form. The 2 assigned teeth for perioprobing, as well as the 3 assigned teeth for calculus detection, are recorded in the boxes at the bottom of the front page. And finally, your finish time for the treatment portion of the examination will be assigned in the evaluation area and will appear at the bottom of this form. If you plan to use a non-injectable anesthetic such as Orchix, enter the brand generic name. You don't need to enter type or quantity of anesthetic and vasoconstrictor. If you intend to utilize injectable local anesthesia, ILA, you will need to enter the type of injection, type of anesthetic to be used, quantity in milligrams of both anesthetic and vasoconstrictor expected to be used, and if the patient has previously received an injection of local anesthesia the same day. Initial ILA approval is for up to 2 cartridges. If you need more anesthesia for patient comfort purpose, you must request approval from the CFE to administer additional anesthesia. Any premedication that your patient is taking must also be listed on the progress form. You can download the medical history form from the website and complete the form prior to the examination day. It must be reviewed with the patient and signed on the day of the examination. The blood pressure must be taken and recorded on the day of the exam. Any responses that are marked with a yes must be explained at the bottom of the form. To maintain the anonymity of the examination process, candidates should only initial and not sign the back of this form until the patient returns from post-treatment evaluation and the exam is complete. Use your clinical judgment to determine if a medical clearance for treatment should be obtained. If you are not sure, it is always better to have one than to have the exam stopped because of not having one. Refer to the candidate manual for more information on a medical clearance. At the start of the examination, just initial on the back of both the medical history and consent form where specified. When you have completed the examination and before checkout with a CFE, sign your name on both forms. The medical history and consent forms may be downloaded, printed out, and completed prior to the examination. At registration, you can affix your label to these completed forms. There are 2 cubicle cards on one sheet. Separate them. Place your sequential number and assigned cubicle number in the spaces designated on each form, and affix one of your peel-off ID labels on each. One card must be displayed in your cubicle in full view of the CFEs and chief examiner. The other is sent to the evaluation station with the required forms during the pre-treatment and post-treatment evaluations. At the end of the examination, the patient needs to read and sign 2 copies of the postoperative care agreement form found in your white envelope. You will also sign and date them. One copy will be given to the patient and the second copy will return to the white envelope. All forms must be returned at the end of the examination. This checkout form is in the white envelope and will help you organize your forms for checkout. The CFE will use the check boxes to indicate receipt of the forms. Gather all your exam forms and ID badge and the white envelope and call over a CFE to check you out of the examination. When checked out, the exam is finished. Gather all of your personal belongings and leave the candidate clinic area.